no one else in the care team has more of a stake in the outcome than the patient and the family, right?
That is one of the modern shifts that's really interesting, and it's challenging our health system. So I've got a background in hospitals, and in hospitals, we ask the patients to become subordinate to our processes. And a lot of the systems and processes are geared at the efficiency either of the organisation or the clinician at the expense of the patient experience. But outside the hospital context, you're talking about primary and community care. And in those domains, health is a service just like any other service in our modern society. And it's interesting to see how the experience of booking travel, you think about rideshare or booking flights these days, retail or banking, you think about how those services have changed over the last decade or two. They define the standard of what good service looks like, where the consumer, the end user, is empowered usually by a digital app that gives them visibility to their activity and their history and their interactions, allows a degree of self-management, autonomy and choice. And then when the consumers actually get to interact with the service, there's a relatively equal footing where the consumer feels like they're empowered to a degree. In healthcare, it's quite different. There's a big asymmetry of information. The health organisation or the health practitioner is capturing that information from the patients, and they've got the specialised knowledge to interpret what that means. They do tests where the tests come back and the patients don't really know what it means, and it has to be interpreted for them. And so the patient is a bit disempowered. But during COVID, we've recognised that patient engagement and consumer-centred care really matters because that's what people are expecting these days. And because it's a relatively new shift for healthcare, the systems don't necessarily exist within the healthcare domain to support those models of care. But we know what the bones of them look like because they've been done in other industries.